Good afternoon, everyone. Where we are today is in a great place, UCSF. We thank Dr. Joshua Adler and UCSF Health for hosting us today. Dr. Adler, thank you so much. We're also honored to have the Vice Chancellor. Where did he go? Vice Chancellor? Well, we'll introduce him when he comes in. It's a privilege to be joined here by Bay Area colleagues. What we are doing here today is part of a national initiative to protect Medicaid. This is everything to us because it's about the children and their families. Many people think that Medicaid is just for children. That would be justification enough. That's our moral responsibility. But this Medicaid is a middle-class benefit because many families depend on it for long-term care for the seniors in their families. Veterans depend on it for disability. People with disabilities depend on it. Let me just talk to you about San Francisco. Republicans want to take $880 billion, that's billion with a B, or more in Medicaid cuts, which would rip away health care for millions of Americans, close hospital and nursing homes, and diminish the quality of care. Here in San Francisco, 100,000 people, including 21,000 children on Medicaid, are at risk of losing their health care. That means 1 out of every 5 children in San Francisco will lose health care. While Republicans choose to protect the wealthy and wealthy, they want to take $800 billion so they can give a tax cut to the wealthiest people in America. Their previous tax cut, over 83% of the benefits went to the top 1%, adding $2 trillion to the national debt. So much for their fiscal soundness. Now, we're pledged to be 2 to 3 minutes each. I have more to say, but what I do want to say is that we're very blessed to be joined by our colleagues, and they're going to self-introduce as we go along. But let me take the pleasure of saying how honored we are to have Senator Adam Schiff with us today, Kevin Mullen, who I'm honored to represent San Francisco with, the Tifa son and a new member of Congress from across the Bay, a star effective from the start. And then we'll hear from Dr. Joshua Adler, Dr. Amy Harrell, Chanel Williams, Sasha Bittner, all of whom will introduce each other as we go along. I have the honor of presiding here today and co-sponsoring this event with Mike Thompson, who represents the northern part of, well, he says the most beautiful district in America. We always compete for that honor. Now Adam Schiff can claim total ownership of it all. But Mr. Thompson serves on the Ways and Means Committee, which has responsibility for Social Security and Medicare, and, by the way, something the Republicans have their sight on as well. He's been a leader on all of these issues. My honor to introduce Mike Thompson.
Thank you very much, and I want to thank the hospital for hosting us here today. It's a beautiful venue. They do great work here, and we're appreciative to be able to be with you. And the speaker's right. We're here because of the children, but we're here because of health care also for all Americans, and we're here because this president and the Republicans in Congress want to decimate Medicaid. They say no, they're not going to touch Medicaid. That is a bold-faced lie. The bill that they passed requires $880 billion in cuts from the Energy and Commerce building. You cannot cut $880 billion without destroying Medicaid. And Medicaid, the destruction of Medicaid, will hurt everyone. 1 in every 3 patients in California is a Medicaid patient. All of this, these bad things that they're doing is for one purpose, and that's to facilitate the tax cut for the richest people in the country. So they're going to decimate health care, they're going to hurt people, and they're going to do it to benefit the richest people in the country through bigger tax cuts. Now, a third of health care in California is Medicaid. You can't cut a third out of any health care organization without hurting not just the Medicaid recipients, but everyone else also. Only one of two things can happen with this type of cut. You either close the hospital or close the clinic, or you drastically reduce the services. So if you have a great insurance policy through your employer, or if you have a pocket full of gold and you want to buy health care on your own, you go to a hospital or a clinic that's had to cut services, it's not going to be available to you. So this hurts everyone, and it's going to cause tremendous problems with not only direct health care, but ancillary benefits as well. And it's going to cost more money. Medicaid pays for services for people who are disabled, for people who have other problems, addiction problems, abuse problems, and by dealing with that through the Medicaid budget, you keep them out of the criminal justice system. You do away with that, it's more expensive for taxpayers dealing with the criminal justice system. And I've got a constituent I met with just yesterday. She's very active, she's employed, and she lives by herself in her own home, and she has a wheelchair that was purchased by Medicaid. That goes away, she doesn't live in her own home, she doesn't have a job, and it's more expensive for taxpayers. This is a bad measure, and we need to speak out. We need to make sure our colleagues in red districts across the state understand this, and they speak out. This has to be solved. Our health care and the people who depend upon health care are going to take a tremendous hit. And it's my pleasure to introduce our newest California U.S. Senator, former House member, great friend, great legislator, great American, Adam Schiff.
Mike, thank you very much. Madam Speaker, thank you for bringing us together, both of you, to shed a light on what is being contemplated by the GOP right now, which would be absolutely devastating to healthcare around the country, and most particularly to states like California that have so many of our residents who utilize Medicaid and are reliant on it, or what we call here in California Medi-Cal. And I want to pick up where Mike left off, and that is, I want to start with the already precarious position of healthcare providers in California. Hospitals throughout our state are barely struggling to survive. Many have had to close their doors. Others have had to curtail important services. In Madera, California, for example, the hospital shut down. People may have already died because they can't get to a hospital on time. That hospital has plans to reopen. It will reopen, though, without a labor and delivery unit. This is another recurrent problem throughout much of the state of California. If California sees a massive cut to Medicaid, we are going to see a cascading set of closures of hospitals and clinics, a lack of access for people. It will be devastating, and those that will be most hurt will be a lot of poor kids, it will be a lot of seniors, it will be a lot of veterans, it will be a lot of people with disabilities. It will be just devastating. And when you consider what they want to make these cuts for, it's all the more devastating. Because they want to take that $880 billion that Mike talked about, they want to take that money and more, and they want to use it to fund a tax cut for corporations and really wealthy people. That's what it's all about. All of these DOGE cuts to essential services, this slash and burning of the services that Californians rely on, it's all with one objective, and that is to find the money to fund a massive tax cut for rich people and large corporations. And if it means that that pregnant mother doesn't have a hospital to go to for labor and delivery, too bad for her. If it means someone with asthma can't get to a hospital on time or can't get the treatment, too bad for them. It means if a senior is reliant on Medicaid to stay in a skilled nursing facility, too bad for them. And that might be easy to say if you're Elon Musk and you're the world's richest man and you can go elsewhere. But for all the rest of America, it would be just terrible news. We're going to do everything we can to fight this because literally lives are on the line. There's no question that if they go through these cuts that they're contemplating, that we're going to see people dying because of it, all for this tax cut for folks who are already doing really well. So we're going to fight this, and I'm grateful that we are here today shining a spotlight on what they're attempting to do, because they would much prefer to do this in the darkness. With that, let me introduce Kevin Mullen, a great representative from the Bay Area who represents my old neck of the woods in the East Bay, and thank you for your great service.
Senator, Madam Speaker Emerita, thank you so much for convening us today. I am Congressman Kevin Mullen, proud to represent the 15th Congressional District, San Mateo County, and the southeastern portion of San Francisco. Recently, I had to be hospitalized for 10 days unexpectedly after developing a bad infection following what was supposed to be a routine knee surgery. The truth is, none of us know when we will have the need for urgent medical care. I was so very fortunate to have health insurance, but I can't even imagine what my family would be facing right now in unexpected medical costs if we hadn't. It is utterly shameful that the Trump administration and Republicans want to strip away health care and Medicaid from millions of Americans just so they can fund a tax cut for billionaires. That is the policy choice that they are making. Just last week, a 7-year-old woman in San Mateo County called my office afraid. My caseworker said you could hear the fear in her voice. She'd worked as a house cleaner for 42 years and was recently diagnosed with lupus. She's paid taxes her entire life, needs Medicaid, we call it Medi-Cal, of course, for her health care, and Social Security, which Elon Musk has called a Ponzi scheme, by the way. She needs that to survive. She's now worried that Republicans' proposed cuts will result in her being unable to afford rent, bills, or food. This is who we are fighting for. As a member of the House Energy and Commerce Committee, I will be doing everything in my power, and our Democratic colleagues will as well, to push back and protect Medicaid, Social Security, and the programs people need to survive in this country. And we will push back against the fiscal straitjacket that the Republicans want to put on vital services in this country. And with that, it is my honor to bring up a rising star, our Rookie of the Year from the East Bay, the Honorable Congresswoman Lateefah Singh.
Thank you all. Thank you, Congressman. I want to first and foremost thank my mentor. I can say she's the mentor of everyone on this panel. The Honorable Speaker Emeritus Nancy Pelosi, for gathering us all here today to focus on children. Just a few minutes ago, we walked out of the emergency room, the children's emergency room at this wonderful hospital. It was a sight to see. There's a room that was constructed where an ambulance bay leads directly to a code room. For the parents who are bedside to their children in this hospital who had to go through that code room, you know the smells and the sounds of that room. There are physician scientists here who have dedicated over 30 years of their adult lives training to be there for when those children come in near death. And they do whatever they can to save them. The hundreds of families who are right now in our children's hospital, just feet away from this room, the members of the Democratic Party, those who are standing here with you today, we have pledged one thing and one thing solely, to tell your story. That children who are living and struggling with cancer deserve absolute care. They deserve treatment. They deserve clinical trials that will bring them more years into adulthood. We have an administration now, this is not hyperbole, that is proposing cruel cuts, not just to the poor, but to the working and middle class. If your child has a devastating illness, we want to make sure that you know that there is someone, there is a crew of us, and we have your back. Every single day in my district and here right in San Francisco County, tens of thousands of folks are utilizing Medicaid to be healthier. These proposed cuts will make us a sicker California, a poor California. But the attack is on the elderly and on the children. We will not let this stand. Children's Hospital of San Francisco and Children's Hospital of Oakland, they need to be applauded. They need more and not less. Young people in the Bay Area and throughout the nation, I want you all to know this is not about red or blue or about who your parents voted for. We are challenging all of us to fight for all of us. As someone who grew up in the city, and lastly I'll say, I went to summer camp with Sasha, who will be speaking today. We went to a summer camp for disabled children called National Association for the Visually Impaired. And boy, oh boy, did we as disabled children love the fact that our parents fought for programming for us. I also grew up with Chanel Williams. We fought on these streets here in San Francisco to make sure that children who were trafficked got health care. The Trump administration is taking away opportunities for young people to live full lives. We will not stand for that. Thank you, Ms. Pelosi, for having us today.
We'll now hear from our host, Dr. Adler.
Good afternoon. I'd like to thank, on behalf of UCSF, thank the entire congressional delegation for your leadership in supporting and preserving Medicaid. It is so critical to the mission that all of us at UCSF and our patients pursue. Your leadership to preserve Medicaid is critical to the health and well-being of over 100,000 current UCSF health patients and millions of Californians. Medi-Cal is the lifeline for over 14 million Californians, providing essential health care for children, pregnant women, seniors, and people with disabilities. UCSF Health is the largest provider of hospital care for Medi-Cal, known as Medicaid patients in San Francisco. Currently, over 70% of UCSF's inpatient care is delivered to publicly insured patients, roughly evenly split between Medicare and Medicaid. Last year alone, 58% of our emergency department patients and 35% of our inpatient population depended on Medicaid coverage for the essential care that they received. The proposal in Congress to cut approximately $880 billion from Medicaid would severely weaken the healthcare system that millions of Californians rely on for high-quality primary care and secondary care, while increasing the uncompensated care costs for hospitals that are already financially stressed, as was already mentioned. As a physician, I've seen firsthand the profound positive impact that Medicaid coverage has on our patients and our community, and simultaneously know the negative impact that would occur by eliminating that coverage. Significant cuts to Medicaid would undermine the entire healthcare system in California and weaken its capacity to provide care to all patients. At UCSF Health, we serve all patients from our community and region, regardless of their ability to pay, many of whom rely on Medi-Cal to access the high-quality specialty care that's unique to UCSF Health, including transplant services, congenital heart surgery for children, complex neurosurgery, and specialized cancer care, just among the few. Medi-Cal payments allow UCSF to preserve and expand services to vulnerable populations. It is now my honor to introduce Dr. Amy Harold, the Chief Administrative Officer and Chief Medical Officer for Providence Queen of the Valley Medical Center.
Hello, I want to thank you for allowing me to come here and share my experience. As was mentioned, I'm Dr. Amy Harold. I'm an OBGYN physician. I'm also the Chief Administrative Officer and the Chief Medical Officer for Providence Queen of the Valley Medical Center in Napa, California, about an hour north of here. When people hear Napa, they think of a glamorous touristy destination, which it is on the surface. But when you peel back those layers at our heart, we're a farming community. We're a service community. We're a rural community. We are considered rural. In my hospital, where I still take home and deliver babies, we have 75% of our patients that are government payers. About 45% are Medicare, and over 30% are Medi-Cal or Medicaid. That goes up to over 50% when you look at our pregnant ladies having their babies, including the one I delivered 2 days ago. We have over 50% of our patients in the emergency department, very similar to the numbers that Dr. Adler shared with UCSF. Our payer mix is approximately the same. And when we look at these proposed cuts, this would be devastating for the hospital. 75% of my payer mix is government-insured payers. Our health system was founded by nuns. I don't say that because you have to be a certain religion to work at our hospital. You don't have to be any religion to get amazing care at our hospital. But they had tenacity, and they started these hospitals. Our health system was started in Emerita, California. They originally were starting schools, and they transitioned to healthcare during the Spanish flu. And those nuns had nothing, and they started hospitals because they saw a need. That legacy has lived. It has lived through multiple generations, ebbs and flows of good times and bad. But we made it through COVID, and we made it through that second pandemic in 100 years. And I would be devastated to see healthcare that has struggled through so many ups and downs be dismantled after going through everything we did and surviving what we did to be dismantled by this. So in my facility, if we lose government payer and the government funding, we will have to close services. I am the only hospital in the county that has a trauma center. I'm the only hospital in the county that has a labor and delivery. Even ones in counties nearby have shut down. If these services close in my hospital, there will be a healthcare desert. So not only do the people that are on Medi-Cal, Medicaid not have access to care, but anyone, regardless of your insurance status, will not have access to care if I have to close my programs. This is what keeps me up at night. Our founding promise was we will take care, it's in our mission statement, we take care of the poor and the vulnerable. That is what we do. That is the legacy of what we do. It means we have slim margins to operate on in order to be able to do that. We don't turn people away. I'm grateful for my colleagues at UCSF that when they have conditions that are past our scope of care in a community hospital, they accept my patients regardless of their insurance status. If that is lost, that will be critically devastating to the infrastructure of healthcare for everyone, regardless of your insurance status. If you need life-saving care, you don't want to have to wait 2 hours to be transferred to another facility. You want that health care available in your community. So I graduated from medical school, I hate to admit this, over 20 years ago. And when I got my long white coat, we had to take our Hippocratic oath, and we had to promise to do no harm. And I'm begging this administration to please do no harm and take care of the American people that you are responsible for. Thank you. I have the honor to introduce Chanel Williams. Thank you.
Well, good afternoon, everyone, and thank you so much for everyone being here. It's my honor to serve as the Executive Director of Rafiki Coalition for Health and Wellness right here in San Francisco, California. I'm here to speak on behalf of thousands of Black San Franciscans who will bear the brunt of these proposed Medicaid cuts. Medicaid is not just a program, but it's a lifeline for our community. Here in San Francisco, over 35% of Black residents rely on Medicaid for access to doctors, medication, mental health services, and preventative care. I have family members who have been on Medicaid as well. We have spent at Rafiki 40 years fighting for Black health equity. The city funds us to provide critical, culturally responsive care to those who need it most. Low-income families, seniors, teens, those who are Black mothers and babies, those who need it most. Medicaid programs were made to advance health equity and address health disparities is a key priority. These cuts would increase our caseload while stripping away the very resources our community relies on. Of course, this would be devastating. So what will these cuts do? They will worsen health disparities. Black San Franciscans already experience higher rates of preventable illnesses and premature death. These cuts would increase deaths from chronic diseases. Black residents are twice as likely to die from diabetes and suffer higher rates of hypertension and heart disease. Medicaid cuts will limit access to prescriptions, specialist care, and life-saving treatments. It will increase maternal and infant deaths. Black women are 3 times more likely to die from pregnancy-related causes than white women. Medicaid covers 40% of Black births in California. Cuts will mean fewer prenatal visits, more birth complications, and increased infant mortality. It will impact our mental health and behavioral health crisis that we're already in. Black communities face higher levels of stress, trauma, and mental health struggles, yet are half as likely to receive mental health treatment due to stigma and lack of access. And we know Medicaid Medi-Cal is the largest funder of mental health and substance abuse services, which Rafiki provides. Cuts will force more people into crisis, into homelessness, and incarceration instead of treatment. At Rafiki, we provide culturally responsive therapy and wellness programs to support Black mental health. With fewer Medicaid-covered services, our clients will have nowhere to turn, increasing demand on our already limited resources. We already know the economic impacts that this will cause, more medical debt to our community. So since 1986, Rafiki Coalition, we've been a leader in community-centered health for San Francisco's Black population. With our early roots in the AIDS and HIV crisis and prevention, we have been a critical voice and advocate for Black communities for decades. Today, we offer robust services to meet the growing and urgent needs of Black San Franciscans, reaching thousands of community members with holistic health care and education. And we are one of the few Black-led organizations here in San Francisco, providing no insurance needed, free and low-cost care to thousands of residents. If Medicaid funding is cut, more uninsured Black San Franciscans will come to Rafiki seeking help, but we won't have the resources to meet the growing demand. Our programs, maternal wellness, chronic disease management, mental health therapy, and holistic healing will struggle to operate without adequate funding. And San Francisco's Black-serving clinics could be forced to reduce services or shut down altogether. We have 4 clinics that we operate as Rafiki, leaving even fewer options for our community. So this is our demand for action. This is a crisis. Medicaid cuts are an attack on Black health, Black families, and Black futures. And we know that these cuts will widen racial health disparities, they will drive Black families deeper into financial hardship, and they will overburden organizations like Rafiki Coalition, limiting our ability to serve our community. So we are counting on our leaders from San Francisco to Sacramento to Washington, D.C. to reject these cuts and protect Medicaid funding. Black health is not negotiable. Thank you so much. And it's my honor to introduce Sasha Bittner from the San Francisco Disability and Aging. She's the San Francisco Disability and Aging Commissioner. Sasha.
Good afternoon.
Good afternoon.
My sister-in-law,
My sister-in-law,
Lori
Lori Hiladakis, will be voicing
my testimony
my testimony
today.
today.
My name is Sasha Bittner,
My name is Sasha Bittner,
and I live in San Francisco.
and I live in San Francisco,
And I'm a UCSF patient.
and have been a UCSF patient.
I'm quadriplegic
I'm quadriplegic
with a speech disability
with a speech disability,
and a vision disability as well. Vision disability
oh, and a vision disability as well,
as a result of cerebral palsy.
as a result of cerebral palsy. I was born to a poor, single teen mother, and while she made the choice to give birth, that involved a tremendous sacrifice of her own life plans, especially when it became clear I was severely disabled. When I was just 3 years old, the doctor told my mother I would never be able to do much of anything. But with a great deal of help from my mom and others, I proved that doctor wrong. The support of Medicaid has been critical to my success. I've relied on Medicaid funding for the home and community-based caregiving support that enables me to live a full and productive life in the community, instead of in an institution or nursing home. I was able to attend and graduate from UC Berkeley because I had someone getting me up each morning, dressing me, taking me to the bathroom, and so on. And with that help, I was also able to provide disability awareness programs to thousands of students in the Bay Area. I'm currently a member of the National Council on Disability, previously chaired the California State Council on Developmental Disabilities, and last year the governor appointed me to the Master Plan on Developmental Disabilities Committee. I also serve on the Disability and Aging Services Commission in San Francisco and participate in numerous other community service activities. The reason I'm able to live such a constructive life is because of the critical assistance I receive every day from home care providers funded by Medicaid. Medicaid has not only been essential for the caregiving I require, but also for my medical care. My entire life, Medicaid has helped pay for my health care, related services, surgeries, wheelchairs, and other medical equipment. In 2013, I was at the Parnassus Hospital of UCSF for 5 months being treated for lymphoma, and I experienced many serious complications related to my disability. If there had been a cap on Medicaid, my family would have gone bankrupt, or I could have just died. For many of us, a Medicaid cap is an actual death sentence. Medicaid has been critical to my ability to live a full and productive life.
For those who prefer
For those who profess
to be pro-life,
to be pro-life,
please
please
note
note
that my life
that my life
did not end
did not end
when I left the womb.
when I left the womb.
There are disabled,
There are disabled,
children,
children,
elderly,
and
other vulnerable people
other vulnerable people
like me
who depend on Medicaid. And the Republican plan to gut this crucial support
is an attack on our very lives.
is an attack on our very lives.
Thank you very much.
Thank you very much.
As you can see, Sasha is always an inspiration to us. We learned so much from her, and also we were so proud that she graduated from UC Berkeley. Not everybody can make that claim. Sasha's mom was with us earlier. We thank your sister-in-law for participating in the presentation. Thank all of our, as you heard from Chanel and from Sasha, who are right there working with people directly. This has such an impact immediately on people's lives. We heard from Dr. Harold and Dr. Adler in terms of the big picture of what it means to institutions who serve and meet the needs of these people. This is about our values as a country. Our budget should be a statement of our national values. What is important to us should be reflected in that budget. But what we see now is an assault on our values as they make this assault on our budget. $800 billion coming out of Medicaid. But we don't agonize, we organize. And this day today, we have scores of events across the country, starting in New York and across the country. And we'll have them tomorrow and the next day and the next day. And the beat will go on. And Chanel, when you talked about the impact on the Black community, our inspiration has been Dr. King from the start. Dr. King said of all forms of injustice and inequity, what is happening with healthcare is the most inhuman because people could die. With that, we'd be happy, our co-chair of this event, Mr. Thompson, and I will be happy to take questions, as will our guests as well.
Let's do on-topic questions first. So, I know that this is something you held an event just a couple of weeks ago, just to have people aware of this. This has come up as a budget resolution that a couple of your senatorial colleagues actually supported. So what should voters do? What can people actually do about what's coming next?
Well, I will yield to anyone who wants to answer the question, but what I would say is when we are operating in the Congress, our inside maneuvering can just go so far. It's the outside mobilization that makes the difference. So what we are doing today with the drumbeat across America, with the impact of these statements you've heard today, not from us, but from others who are at the mercy of or delivering services to those at the mercy of. That drumbeat is really important. And what we want our Republican colleagues to do is to hear it from their own constituents. Nothing is more eloquent to a member of Congress than the voice of his or her own constituents. And when the Republican members, like in California, there's one member. We have about 800,000 people in our districts. Not you anymore. He has 500,000 people on Medicaid. We want his constituents to tell them what it means to them.
Who is that?
You know, as Speaker Pelosi has reminded us often, you know, public sentiment is everything. With it, you can do anything, and without it, you can't do anything. I think somebody else said that too, but I'm going to tune into my heroine, Speaker Pelosi. And the inverse is true. If your constituents are outraged and speaking out, you hear that. And as the Speaker said, we have a colleague, a Republican colleague, who voted for this stuff, who has the biggest Medicaid population in the country. He needs to hear from his constituents. Every red district needs to speak up. This is absolutely tragic. If this were to go through, health care is going to be devastated. That particular member of Congress, like myself, represents a big rural area. This is a huge hammer on rural health care. It will change the whole healthcare scene in rural America. And these folks need to speak up. And so events like this shine a spotlight on this. Let folks know. Let them speak up. It's really important.
A lot of Republicans will see this day of representatives speaking all over the country like you are, and they'll say a simple line. Trump will say, "We're not touching Medicaid."
Well, if his lips are moving, he won't be telling the truth. You know that. And that's what we have to protect ourselves against. And perhaps he'll get to a place where he will understand they cannot touch Medicaid to give tax cuts to the richest people in our country. All we're talking about is people paying their fair share. It's about fair share for them. They should pay their fair share. And we should have a fair share of respect for the people in our country. That's who we are. So, again, he may say that, but we don't accept that. He said, what did he say? Social Security is a scam. His co-president has said it is what? A Ponzi scheme. Musk. So we're not taking any word from him as, shall we say, gospel. We're just in this fight to make sure that these Republican members go to their leadership and say, I can't vote for this. My members, my constituents have spoken out. Anyone else want to speak to that?
I want to add one thing to that. This isn't a bunch of politicians having press conferences across the country. You're hearing from medical professionals. You're hearing from the recipient of the medical services that they provide. This is my third press conference on this issue, two others in my district, surrounded by medical professionals, doctors, nurses, nurse practitioners, and the benefactors of that good health care. These are the people who are telling their patients that they are in trouble and in threat of losing the health care that is so important to them.
Next on-topic question. On topic?
I would just add one other thing to your question about can we believe what they're saying? Can we believe what Donald Trump is saying about cutting Medicaid or not cutting Medicaid? You can look at what he's saying, and of course, as the speaker was saying, he has no problem lying 5 times a day or an hour or a minute. What I look at is what are they doing? And when they passed a budget that requires $880 billion to come out of a particular pot of money, and there's no way you can find anywhere near that without decimating Medicaid, it's clear what they're doing. So what I would say, for an administration that lies out of its teeth all the time, ignore what they say and look at what they're doing. What they're doing is cutting Medicaid.
Yeah. Okay, we'll go here for on top of the very few, you mentioned getting the message out to red districts, but very few Republican congressmen and women are having town hall meetings in their districts.
They were told not to by their leadership.
So what is your plan to get that out there? And also, second part of the question for Senator Schiff, Speaker Emerita, do you still have faith in Senator Schumer to lead the Democratic caucus in the Senate?
Well, we're focusing on this subject now. Hold that later.
Kind of related.
No, everybody has friends in another district. We're telling them to call your friends, call your family members who live in those districts, to have them call their member. Don't you, I've said to our constituents at our press conferences when we've had the town meetings or the tele-town meetings, you're wonderful, but it isn't helpful for you to call a Republican member. You have to have somebody in that person's district call the Republican member. I consider my constituents my bosses. I hope that they do too.
Hi, Monica Madden, ABC7. How are you all, obviously there are fewer Senate Republicans who are supportive of these cuts, just given the nature of the districts as compared to the House. I mean, how are you all leveraging that divide in terms of negotiations and, hopefully bringing that back to what ends up in the House?
We've had all too many experiences, I think, in the Congress and both houses of hearing very private reservations of many of our Republican colleagues and seeing those private reservations not materialize into public demonstrations of their conviction. And so I take with a certain grain of salt when I hear my Republican colleagues talk about how they don't support some of what the administration is doing. Until they start voting that way, it's not going to be meaningful. Now, they are hearing from their constituents. And they know as well as we do on the Democratic side of the aisle that if they go through with this massive cut to Medicaid, their states are going to be even more adversely impacted. As a percentage of their constituents, they're going to be just in dire straits. Our state doesn't have the resources to compensate for loss of this money. Their states certainly don't. So there's going to be a point where they're going to have to demonstrate the public courage necessary to reject this. I think they're all waiting for the president's honeymoon to come to an end. It is coming to an end before they will be willing to speak out and to act out in a way that protects people's health care.
Actually, we had a third way this time. We had a resolution that would be bipartisan, and that both of the top Democrat in the House and the Senate, Patty Murray and Rosa DeLauro, introduced that legislation. It was well known to the Republicans, and that could have been a path where we said to the Republicans, you can give us this resolution. If they said no, they would have shut down government. But to a larger sense of your question, their elections are right around the corner in the House. I'm just speaking of the House. Right around the corner. Between March and September, they'll figure out whether they're going to run again, because his numbers will come down and their constituents will be telling them what they think of how they're voting. So in the course of this 5-6 months, they have to either vote better or understand that the election is coming soon. Hakeem Jeffries will be the Speaker of the House, if I may talk civics, or if you want to call it politics. And they know that. So again, when you say leverage, the leverage, elections are the elections. People's vote is their voice in all of this.
Yeah, Pedro Crackler with the San Francisco Standard. I'm wondering if you can name any Republican colleagues that you think are most likely to come on your side on this issue.
I wouldn't, I can, but I won't.
Dustin Gardner from Politico. I'm curious, what do you think it says, the fact that Republican leadership told their members not to hold town halls on this issue? What does that tell you about the state of play on the ground?
The leadership told them not to have town hall meetings.
Well, the optics have been terrible. if you see the clips from Republican town halls, they are facing their voters, and their voters are making it very clear that they're unhappy with the direction that the Republican leadership in the House is going. We are holding town halls. I'm holding a town hall Thursday night, which is sold out at Carlmont High School in Belmont, and I look forward to hearing from my voters, who also, I think, are expressing just dismay at what's happening in this country. The authoritarian moves by Trump and Musk, they are at their wits' end. I'm going to hear from them, but that is our job, to listen, not just to niceties from our voters, but the reality that they're facing. And I'm sure we'll also be hearing I'll be hearing from Medicaid recipients who are very concerned about the $800 billion, which, by the way, is in the resolution. The $800 billion is coming to my committee, Energy and Commerce, and we're going to fight like hell to block those cuts.
Some of you told your constituents and your colleagues to stand up and fight over the CR. I think a lot of people out in the country don't know the difference between a CR. They hear from you to fight, and then other members of your party seem to give up that fight. What would you say to them who became frustrated with how last week went? What's different now? What's the fight now compared to last week?
If I just may have any questions about Medicaid and the impact that it will have on children, on seniors, on people with disabilities, on our veterans and the rest.
I'm curious, what does...
If you had a question, I'm sorry.
But what portion is that of what, I mean, $800 billion is a big number, but what portion of Medicaid is that? Like...
A devastating portion.
Yeah.
It's life and death. It's devastating.
And if you add the $230 billion that they want to take from food stamps, I don't think it's coincidental that that's about the exact amount of money you need to give a tax cut to people making over $743,000 a year.
I have a question. Several of you have spoken about individuals, calling their offices legitimately concerned about the future of their health care and their Social Security. When you might not be able to make concrete promises to them, how do you handle conversations with that?
Well, it's just, that's our life. That's our life. We listen, we learn from our constituents. In fact, we even pick up some of the vocabulary that is more useful as we go forward, because we say it the way they tell us. But that is our life, and we have great staff that take many of the calls, and that's why we have the town halls or in-person town halls to listen to people. But the town halls have been so popular because thousands of people can participate, and they can make their suggestions, or they can hear what others have to say. But that's our job, to listen, to learn, and to act upon the values that we share. Tell us who you represent.
Oh, my name's Holly Rash. I'm with the San Mateo Daily Journal.
Have found that. Welcome.
Just to add on that, slightly off California.
I just want to answer your question because, again, this goes to what they say and what they do. They say on the one hand they're not going to cut Social Security, but we see them closing down Social Security offices. We see them laying off Social Security workers, and the result is that people that haven't received their check or can't find out what happened to their check are calling offices that aren't open anymore, or they're put on hold for indefinite periods of time. And we hear that because then they call our office. So first they're going after the people who work for Social Security, and then they're going after the check. But they know that if they can interfere with your ability to reach it, they can essentially interfere with your ability to get your Social Security check that you've earned, that you worked your whole career for. So we hear that from our constituents, and we try to help them get through to the administration. But these are not coincidental happenings. There's a design behind this, and it is to try to make these programs die on the vine, deprive them of the resources they need, and as the speaker was saying, just use that money for a tax cut for people who are already doing really well.
We have time for one or two more.
Can you answer one of the questions that came before? I mean, how do you delineate right right now from last week in terms of communicating with your constituents about the ability to fight a good fight
Well, that falls into the category of a question outside the scope of this, and I'll come back to that.
Okay.
We'll come back then. This gentleman's question as well.
Just talking about California healthcare. Last year, California expanded Medicare eligibility to all undocumented immigrants. And just recently, that expansion has exploded the program's cost by billions of dollars. Given this, do you think it was wise for health insurance to be given to all able-bodied adults, including illegal immigrants? And would you encourage all other states to do the same?
Well, and you're talking about some undocumented immigrants who were able to get health care. And I just caution you before speaking out against something like that. If your neighbor is undocumented and has a communicable disease and your kids get it and die, it doesn't stop. The health care issues don't stop at the property line. And the same thing, someone who is injured needs to get help, they should get help.
We're not talking about other states here today, just California and San Francisco. And that, again, is, as I say, the drumbeat across America. Our calls are from our bosses, our constituents, who are there. What was your question? Yes.
You still have confidence in Senator Schumer to lead the Democratic caucus in the Senate, both for you and Senator Schiff.
I do.
Well, to quote, and I guess this gets to your question and the previous question as well, to quote the speaker, and speaker, forgive me if I get the quote wrong in part, the speaker always says that our diversity is our strength, but our unity is our power. We were not unified last week. And as we're in the minority in the House and we're in the minority in the Senate, the only way we're going to be able to stop bad things from happening is if we're unified. So we're going to have to do a lot better the next time a key issue like this comes up. I'm not going to opine on the sort of internal caucus politics as a freshman. I'm going to leave that to more experienced people. But I think the speaker's words really ring true to me. We're going to have to figure out a way where leadership in the House and leadership in the Senate is on the same page, and we're clearly communicating a unified message about the harms this administration is doing and is contemplating.
What do you think needs to happen next time so there aren't those decisions?
You both had the same question. Well, I'm concerned about the next time. I'm concerned about the future. What happened last week was last week. We're going into the future. And this morning, Hakeem Jeffries and Chuck Schumer joined in this kind of an event in New York, where Hakeem said that he had confidence in Chuck Schumer. So we're to the next stage on this now. But your question and yours, it is about what comes next. I myself don't give away anything for nothing. And I think that's what happened the other day. We could have, in my view, perhaps gotten them to agree to a third way, which was a bipartisan CR for 4 weeks, in which we could have had bipartisan legislation to go forward. I'm an appropriator. Mr. Schiff is an appropriator and with the Appropriations Committee. They may not have agreed to it, but at least the public would have seen they're not agreeing to it. And then they would have been shutting government down, because we don't want government to shut down. And by the way, just from a historical standpoint, in modern times, all the shutdowns have been precipitated by the Republicans. Newt Gingrich in the 90s with Clinton. Clinton didn't shut it down, but Newt Gingrich insisted on shutting it down when Clinton was president. Boehner, when Obama was president, he insisted on shutting government down, Speaker Boehner. The President of the United States going out the door, the longest shutdown in history, was it 35 days or whatever it was his, and he said he was really proud. He was really proud to shut government down. So shutting government down is a Republican initiative. It has been consistently. We haven't. That isn't who we are. So we weren't going to be shutting government down. We just wanted to have another path to make sure we could keep it open, or if it didn't stay open, that people knew why.
That was Trump. The 35 days was Trump.
What did I say?
You didn't.
Yes.
Make sure they know.
Oh, I don't like to use his name, so. What's his name, I said, I guess. Anyway, I was in the room when Chuck and I were negotiating with him on this, and he said, I'll shut it down, I'll be proud to. And he did for a long period of time. And then we took the majority, we went in a few days later, took the majority, but it took a while for us to get him to sign anything. So in any event, it is, again, it's about the budget. It's about the budget. It's about the statement of values of who we are as a country. They talk about fiscal responsibility. I invite any of you to join in on this. Fiscal responsibility. They gave a tax cut to the richest people in America. Over 80-some% of it going to the top 1%. And it added $2 trillion to the national debt. Unpaid for. $2 trillion to the national debt, and now they want to do it again double. Okay, you want to speak to that? Because you're the chair of the tax subcommittee.
I just want to point out, we've talked a lot about them cutting different programs that are important to the American people. Medicaid, I mentioned the food security programs in the Department of Education. But even if they do all this stuff that they're talking about doing that harm Americans, they still don't come up with enough money to pay for these tax cuts. So they would still be adding to the national debt after they've decimated safety net programs, health care programs, food security programs. So if there's a scam out there, it's those guys. It's not Social Security, it's not Medicaid, it's those guys. And that scam will fall directly on the shoulders of the families of our great country.
Our distinguished colleague who is here is on the Oversight Committee, and they have, she saw that?
No, she
They have oversight over everything in government. So when they talk about waste, fraud, and abuse, that's our responsibility, our oversight of spending. They have made up this thing, and it resonates with some people in the public. Oh yeah, waste, fraud. No, there shouldn't be any waste, fraud, and abuse. But that's not calling Medicare, no, Social Security a scam, Trump, a Ponzi scheme, scam, Ponzi scheme, back on them.
Don't the inspectors general find the waste, fraud, and abuse?
That's what they do, except they were all fired by
Still not
Donald Trump. That's a very strict regimen under them. But anyway, thank you all for coming. Let us thank our special guests for their this is a drumbeat across America today, tomorrow, the next day, and again for a long time to come about other subjects that relate to the health and well-being of the American people. Thank you all so much. Thank you, Mr. President.
Are you traveling to other hospitals? I thought we would get off the bus. I was wondering if you're traveling around.
Well, we went to the Children's Hospital for a tour to begin with, and we took the bus from the Children's Hospital.
I brought my hospital with me, Providence.
Thank you, everybody.
Thank you.